الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Measles and Measles Vaccine by Professor Mahmoud Hani Sulaiman. Measles is a highly contagious viral illness first described in 7th century, near universal infection in pre-vaccination era, common and often fatal in developing areas. Measles virus, paramyxovirus, RNA, hemagglutinin important surface antigen, one antigenic type rapidly inactivated by heat and light. Pathogenesis, respiratory transmission of virus, replication in nasopharynx and regional lymph nodes, primary viremia 2 to 3 days after exposure, secondary viremia 5 to 7 days after exposure with spread to GIT and skin. Measles virus infection pathogenesis, clinical features, and immune responses. These three figures summarize these pathogenesis and clinical features. A, B, and C. Measles epidemiology. Reservoir, human, transmission, respiratory and airborne, seasonal, peak in late winter and spring, communicability 4 days before to 4 days after rash onset. Public health significance. It was once common, acute, highly communicable disease with potentially serious sequelae. So it is a story of success of public health measures, preventive measures, and vaccination. It is rare since introduction of widespread immunization. Epidemics are still occurring, especially in school-aged children. Death is rare but does occur. Immunization led to indirect protection of unimmunized persons, which is called herd immunity. In lectures of general epidemiology, we talk much about herd immunity. Measles vaccine lead to achieving increased mean age of infection and an increase in time between epidemics. Despite availability of effective vaccine for 40 years, this is still considerable burden in many countries, primarily due to underutilization of vaccine. In 2001, there were 30 million measles cases and 37,000 deaths. Most deaths occurred in developing countries. Vaccine at 12 months lead to antibody in 95% of recipients. It is unknown whether vaccine-induced immunity is lost over time, but majority of evidence suggests that this is uncommon. Clinical features. Incubation period 1 to 12 days, prodrome, a stepwise increase in fever to 38.2 degrees centigrade or higher, cough, coryza, conjunctivitis, complex spots, which is important, on buccal mucosa, white elevated mucosa with redness at center. So white elevated mucosa with red center opposite second molar tooth. This is the Koplik spot, white or bluish lesions with erythematous halo on buccal mucosa in first 2 days of measles. This is another picture for Koplik spot, very small bright red spots on the buccal mucosa. Still in clinical features for measles, rash occur 2 to 4 days after prodrome, 14 days after exposure. This is to calculate when was the patient was communicable, so know who were exposed. Maculopapular becomes confluent, red blotchy, begins on face and head, persists 5 to 6 days, fades in order of appearance, immunized persons may present with non-classical features. This is the rash of measles. Maculopapular becomes confluent, red, blotchy, persists 5 to 6 days, fades in order of appearance. Measles complications, the most important one is hospitalization. Also diarrhea, otitis media, pneumonia, encephalitis, and death are rare, but hospitalization is the most prominent complications. That is to say, if an epidemic occurs, it will cause a great burden on hospitals. Measles lab diagnosis. Isolation of measles virus from a clinical specimen like nasopharynx. Significant increase in measles IgG by serology. Positive serologic test for measles IgM antibody. Clinical case definition. Generalized rash lasting more than 3 days. Temperature more than 38.3 degrees centigrade. Cough, coryza, or conjunctivitis. Control of a case, school exclusion for at least 5 days from appearance of rash, at least, or until receipt of a medical certificate of recovery from infection. Isolation of hospitalized patient. All this is measures for preventions, standard precautions, airborne transmission precautions. Standard precautions and airborne transmission precautions. We talked much about this in general epidemiology. Indicated for 5 days after onset of rash in healthy children, but for immunocompromised patients, these precautions will be taken for duration of illness. Exposed susceptible patients placed on airborne precautions from day 5 after first exposure until day 21 after last exposure. Control of contacts. Contacts checked for measles vaccine. If not given, then give in 72 hours of exposure. Persons born before 70s regarded as immune contracted measles in childhood. Children between 6 to 12 months given MMR or revaccinated at 12 months or 3 months after the last dose, whichever is later. Still in control of contacts. Also, you can give normal Ig to child in this age a dose of 0.2 ml per kilogram, then to vaccinate at 12 months or 3 months after giving Ig. In school, check vaccine status of class contacts. Contacts without a vaccine excluded for 13 days from first appearance of rash in last occurring case, unless they are immunized within 72 hours of first contact. Still in preventive measures, live attenuated measles vaccine recommended for all persons born after 70s unless specific contraindications to live vaccines exist. It is recommended to be given at 12 months, at 4 to 6 years, second dose. Measles vaccine of any disease is dynamic. As we see here, many vaccines were introduced into the market. Some of them was withdrawn. It is a dynamic process. It is not static. Measles vaccine composition, live virus, efficacy, live attenuated virus. Efficacy 95%, duration of immunity lifelong, schedule 2 doses, should be given as MMR because it is more potent in inducing immunity than measles vaccine alone. MMR vaccine failure, why we still have cases of measles. Measles, mumps, or rubella disease in a vaccinated person. It may be failed because when he was given the vaccine, he was diseased with one of these viruses, or the person himself lack immunity. About 5% of recipients are responders to first dose. Will respond will lead to antibody damaged vaccine record errors. This is another causes of failure. Presence of antibody damaged vaccine record errors. Most persons with vaccine failure will respond to second dose. Indications of MMR: all infants at or more than 12 months of age, susceptible adolescents and adults without documented evidence of immunity. MMR vaccine: 12 months is the recommended minimum age. MMR given before 12 months should not be counted as a valid dose. Revaccinate at 12 months of age. Second dose: first dose at 12 to 15 months. Second dose at 4 to 6 years. Second dose may be given anytime more than 4 weeks after first dose. Adults at increased risk of measles: college students, international travelers, healthcare workers. Healthcare workers. Measles immunity in healthcare workers: all persons who work in medical facilities should be immune to measles. Again, all persons who work in medical facilities should be immune to measles, so it can be contracted and considered occupational. Measles immunity: when to regard a person immune, they can born before 1957, documentation of physician diagnosed measles, serologic evidence of immunity, documentation of receipt of measles containing vaccine. Indications for vaccination: again, vaccinated before 12 months, vaccinated with killed measles vaccine, vaccinated prior to 1968 with unknown type of vaccine, vaccinated with IG in addition to further attenuated strain, or vaccine of unknown type. Adverse reactions: as we see, fever, rash and joint symptoms. MMR adverse reactions: this will be mentioned again in mumps and rubella. Fever, rash, joint symptoms, and the other are rare as thrombocytopenia, parotitis, deafness, encephalopathy. What is the relation between MMR vaccine and autism? Measles vaccine connection first suggested by a British gastroenterologist. He is not licensed in infectious disease. Diagnosis of autism often made in second year of life. And in his paper, he diagnosed autism in second year of life. So the relation with MMR is distant. Multiple studies have shown no association. Again, what is the relation of MMR vaccine and autism? The evidence favors a rejection of a causal relationship at population level between MMR vaccine and autism spectrum disorders, or the autism spectrum disorders. Who said that? It is the Institute of Medicine in April 2001. MMR vaccine contraindications and precautions. Severe allergic reaction to vaccine component or following prior dose. Pregnancy is a contraindication. Immunosuppression, moderate or severe acute illness, recent blood product. Measles, mumps vaccines, and egg allergy. Safety of MMR in egg allergic children. Now, this is the case now. Measles vaccine and HIV infection. MMR recommended for persons with asymptomatic and mildly symptomatic HIV. So it can be given to HIV patient, but with who are asymptomatic or mildly symptomatic. Not recommended for those with evidence of severe immunosuppression. Pre-vaccination HIV testing not recommended. MMRV not approved for use in persons with HIV infection. So the addition of the varicella part to the MMR is not till now approved. PPD Measles Vaccine. What if we were going to do PPD and measles vaccine? If at the same time apply PPD at same visit as MMR. Apply PPD as same visit as MMR. Apply PPD first, give MMR when skin test rate. يبقى apply PPD first, then give MMR when skin test rate. إذا بقى العكس delay PPD more than 4 weeks if MMR given. If it is خلاص okay given, so we have to delay PPD for 4 weeks. Storage and handling MMR vaccine at the clinic. في المستشفى بتاعتك وفي العيادة بتاعتك. At the pharmacy, it is another issue. We are now talking about your clinic. Store at 2 to 8 degrees centigrade may be stored in the freezer. Store the diluent at room temperature or refrigerate. Protect the vaccine from light, whatever. It must be protected from light. We talked about this in general epidemiology. We talked much. Discard if not used within 8 hours of reconstitution. Storage and handling MMR vaccine must be shipped to maintain temperature at minus 20 degrees centigrade at all times. Stored when it reached the hospital, stored at an average temperature of minus 15 in the pharmacy of the hospital or at the rooms in the district, health district, at all times at the store. Must be given within 30 minutes of reconstitution. Must be given within 30 minutes after reconstitution. This is the summary for recommendation for measles immunization. This is the summary. Please print it and put it. This is the summary. Print it and put it in your desk at your clinic. Epidemic measures. Outbreak exists if one case of measles is confirmed. This is the definition of measles outbreak. Outbreak exists if one case of measles is confirmed. If one case confirmed at school, at hospital, at anywhere, it is an outbreak. Diagnosis should be established that disease is actually measles. See clinical or lab case definition. Okay? You must follow this definition. Nasopharyngeal aspirates collected and transported to National Reference Lab for immunofluorescent identification of measles antigen. This lab is present at Vaxera. يوجد في المصل واللقاح هذا في مباني المصل واللقاح هذا المعمل. The National Reference Lab for Measles is found there. The measles epidemic or outbreak is a serious disease. This must be done. This is a rapid method. Specimen is then cultured for virus. Alternatively, a blood sample 10 milli in a plain tube collected immediately after child presence with rash and sent to Vaxera again to look for measles specific IgM. A second specimen 10 days later is useful if IgM result is equivocal. Still in epidemic measures, it is a serious disease. For school-based outbreaks, class levels involved should be revaccinated. For all children who do not have documented evidence of 2 doses of measles containing vaccine. Epidemic measures for outbreaks involving preschool children. If the child 6 to 12 months can be offered MMR vaccine, which may prevent measles if given within 72 hours of contact. If the child are immunized, they should be given another dose of MMR at 12 months of age or at 3 months after first dose, whichever is later. Epidemic measures for children from 0 to 6. These children can be offered immunoglobulin, which may prevent measles if given within 6 days of exposure. This is the immunization schedule in Egypt. I put it here only to show you that MMR is a compulsory vaccine at 12 and 18 months. Please print this schedule and use it in your clinic. This is in Arabic, the same schedule, and I put it here for you to print it and use it for health education for your patients. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you.